3D guided breast biopsy is essentially a type of mammographic guided percutaneous biopsy. You have to understand that when we started doing three-dimensional mammography or tomosynthesis, we were seeing things that we didn't necessarily see with standard mammography. So we needed a new way to target these lesions. The actual biopsy itself is performed with the same tools that we use for standard stereotactic biopsy, and that is vacuum-assisted large bore needles under local anesthetic. Prior to this technology, we were using stereotactic prone techniques, and that is where the patient is lying on a table, where the breast is suspended underneath them, and we perform a biopsy in that manner. 3D biopsy improves patient care in several ways. One is that there are certain patients that simply cannot lie on the table. So patients with arthritic conditions, for instance, find it more comfortable to be seated when we perform the biopsy. Another advantage is it's quicker. We traditionally allow about an hour to perform a stereotactic biopsy. We can do a 3D biopsy in approximately 15 to 30 minutes. So time savings is big for us. Also, we do less mammographic views, which means that there's less radiation involved. When we seat a patient, it allows us to position a patient in a way that we can get lesions that are closer to the chest wall that were more difficult to biopsy with traditional stereotactic prone techniques. And finally, the imaging capability is better so that for very subtle lesions like architectural distortions in the breast or fine calcifications, we see them better with the 3D targeting, and therefore we can do lesions that we couldn't see before. The future of breast cancer detection, as far as imaging goes, is probably going to be techniques such as molecular breast imaging, sophisticated MRI techniques, and potentially advancements in 3D imaging. UPMC is a leader in 3D guided breast biopsy because we were the first in the United States to have this technique, and we've been working with it to help develop it and compare it to the old techniques and see how it will be advantageous to us. What oncologists need to know about 3D guided biopsy is that it is essentially performed in the same circumstances as stereotactic breast biopsy. It's just that it is more efficient, it's more comfortable for patients, and requires less radiation.